Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
As the Department of Veterans Affairs moves to eliminate 30,000 jobs through attrition, National Nurses United is joining forces with federal unions to push back, warning that the cuts could erode frontline care and shift veterans into a fragmented community care system. That message was front and center at a recent town hall in Georgia. Here with the nurse's perspective is longtime VA nurse and chair of National Nurses United's VA division, Irma Westmoreland. Irma, thank you for joining me.
Thank you, Terry. I'm excited to be here to talk to you today.
All right, well, let's start with the big picture. National Nurses United recently held a town hall to spotlight the VA's plan to cut 30,000 jobs through attrition. From your perspective as a nurse, as a care provider, what's really at stake here for veterans and frontline staff at VA?
Well, the administration is looking to cut staff, which is what you said, but that cutting of staff is already started through attrition and other ways and laying off of different staff, not medical staff, but through attrition, medical staff are gone and going. That would be nurses, doctors, practitioners, PAs, those kinds of things. And already staffing is already cut to the bone. And one of the things that we are concerned about is the more staff you cut, the less services we can provide. And then you get to the problem of privatization, which is what we really feel that is happening here, is that the administration wants to make sure that they silence the nurses who are fierce advocates for patient care and push employees out of the VA, starve us of our resources, and then have an impact on our ability to have high quality care for our veterans. Taken together, what that means is it's an effort to cripple the VA and privatize care and send more veterans to private sector where we know that care is often more expensive and certainly often more inferior.
Irma, let me be devil's advocate for just a minute. The VA argues that community care is a cost-saving mechanism and that it will help fill the gaps in the VA system. Obviously, National Nurses United, you just made the case against that. What are you hearing from veterans specifically with their experience in community care?
Well, in our recent town hall, we heard from a long-term veteran who was from the Vietnam era, and we heard his wife's story, who was also a veteran and cared for at the VA. She had started getting her care in a privatized way in one of the clinics that they sent her out for care. She was not happy with her care. Her care was going very poorly, and she was brought back into the VA after he had to fight with the administration to get her care returned to the VA, as what is often happens. Once you're out there, sometimes it's very difficult to get back, even if you want to. His wife had dementia, and she had holistic dementia care at the VA. Her family, her husband, was so grateful for all the things that we had done for her and really just gave her a sense of belonging and a sense of the VAs where she needed her care. And then he talked about his care and how important it was for him and how he continues to get his care at the VA and why. He says the care at the VA is astronomically better than outside. Those are the words he used. He said that he had noticed his wife's care, his care, and he continues and will always continue to get his care at the VA, even if they offer him outside the VA. And that's the problem with offering care and privatization of the VA. Secretary Collins says that getting care outside is veteran care, but we as nurses say it's not. It's just an appointment somewhere else, and it does not give you the type of care that you can get in the VA. Through research, it's shown over and over again, care in the VA is almost always better than the private sector, but it's never inferior to it.
Irma, you've said that the shift to community care could create a two-tiered system. Can you tell me more about what that means?
Yes. In the VA, we have quality indicators, which means that we are constantly scrutinizing the care that we give to make it better, looking at it, researching it, making it better all the way around. But when we give care and send care outside of the VA into the community, those folks don't have to give us any quality data. They only have to give us back that they saw the patient. That's it. And what they did for them, never proving that anything that they're doing is better than what we're doing or even equal to what we're doing. And And that does cause a two-tier system. In the VA, you get better quality care because we monitor it continuously. But in the outside, that's not even a requirement.
I'm speaking with Irma Westmoreland. She's a registered nurse and chair of the National Nurses United's VA division. Irma, veterans themselves have been speaking out, sometimes through protests. You had some of them at the town hall. What are you hearing directly from them, and how are you including their voices in your campaign?
Well, as nurses, we always take a strong stand against anything that impacts our patient. And one of the things we do as nurses and as union nurses is that we stand for our patients. We bring issues forward when there's a problem. And that's why it's very, very important for us to have our union rights. And then if you don't have those rights, then we may not be able to bring issues forward protected, right? And so that in itself will cause people to not necessarily bring an issue forward, which may have an impact on our patients' care. But most importantly is that our veterans, when they come to the VA, there are things that you can get at the VA that you can't get anywhere else. Our patients are interacting with other patients. They have camaraderie there. They have people who have research-based care on all the things that happen in combat and how we deal with them, including all the things that are happening now, like more traumatic brain injuries because we have better coverings and vests and helmets and all the things that our veterans need to go to war are improved, right? But it also means now we're having more injuries or different injuries, like these burn pit injuries, or like the patients with tinnitus are having hearing issues because they're getting concussive wounds from bombs and stuff. It's in IEDs. And so there's a lot of things that are happening that are specific to our patients. And of course, we'll also always have PTSD and mental health issues, or people who go to combat, come back different. Our nurses and veterans' families tell us many, many stories about how their families needed something and the VA saved them. People who come back change really need the support of the VA that you can't get anywhere else.
Irma, National Nurses United is also working really closely here with AFGE and NFFE. How are the unions working with you to get the message out?
We're working with AFGE, NAGE, NEFI, SEIU, and AFSCME, and we are working with them together to where we can do protests together, where we can do actions together, where we can do cases together, so that we all are on the same message. We all want the VA not to be privatized. We want the VA to survive. And the only way that can happen is if the VA is fully funded. The administration right now is starving the VA of resources monetarily and in staffing in an effort to make sure that we privatize the VA. If you continue to cut and give resources to the outside away from the VA, then what's going to happen is we will not be able to bring all the services that we need to have. If the VA were fully funded, taking all the money that we had taken and put elsewhere, then we could take that inside and do more services for our veterans, which is what we want. We want every veteran to get services here. And it's going to be even more difficult. I live in Augusta, Georgia, and in Augusta, Atlanta, the VAs that we have here, we have medical meccas is what I call it, because we have tons of specialty services in our areas, tons of other hospitals, tons of resources. But even with those resources, they specialty care, things that you need, cardiology, endocrinology, all of those specialty cares that you need, they all have long wait times everywhere else too. If our wait times are 18 days, theirs might be 17, or theirs might be 21 and ours is 20, but the cutoff is 18 and we have to offer privatized care. And it doesn't mean they're getting any longer or less wait to go there. But what happens to the rural areas? They're not like Augusta. They're not like Atlanta, where we have these specialties here. What happens to those people? They are not going to be able to get the care. Their care is even longer wait, and they can get a better care in the VA. We need those services brought into the VA. We need physicians brought on. And we're just having during this time that we're having during hiring freezes, and then they're saying they're not freezing medical care, people coming on. But like in Augusta, we brought 2 nurses in last week, we brought 2 nurses in. Those were the first 2 nurses that we had brought in that were staff nurses since April. And there was a physician coming in. I think there's only been 3 or 4 physicians brought in since April. how can you keep up with the attrition that you're doing? And that's one of the things they're saying that they're doing to get rid of staff now is doing it through attrition. But you can't control where people leave from. And then how are you going to hire back from them if you can't afford to get people in and it takes 6, 8, 12, 18 months to come into the VA? How can you possibly keep up with that?
Irma, thanks for laying out those challenges. You mentioned really that the core of the issue is funding. What are you hearing from members of Congress who really control the funding for the VA at this point?
Well, what we're doing is we are, through our town hall that we recently had and all of our actions, we are asking people to call the members of Congress, call the people that are on Congress and Senate, our Congress people and our senators that are on Veterans Affairs committees in the Senate and the House. Talk with them about what your needs are, asking them to fully fund the VA, even though the president's budget and Secretary Collins' budget, the things that they're asking for are not enough for the VA. And they're taking that money and adding more of it to privatized care to give these other people outside who give inferior care or more expensive care than we do there. If it was funded in the VA, we could do all of that. We know a healthy VA equals healthy vets. A healthy VA is fully staffed and fully funded, and the VA can serve all the vets that are in need.
I've been speaking with Irma Westmoreland. She's a registered nurse and chair of the National Nurses United's VA division. Irma, thanks so much for joining me this morning.
Thank you, Terry.
We'll post this interview at federalnewsnetwork.com/Federal Drive. Listen to the Federal Drive on your schedule. Subscribe wherever you get your podcasts.
What makes a great leader in government? Christine Harada joins WEPA CEO Shane Canfield to reflect on her journey from aerospace engineering to the White House. In this episode, she shares lessons on public-private collaboration, leading with purpose, and why service, not power, should guide leadership.
Hello, and welcome to the Lessons in Leadership podcast. I'm your host, Shane Canfield, CEO of WEPA. Today, I'm joined by Christine Harada, former Senior Advisor at the Office of Federal Procurement Policy within the Office of Management and Budget. Ms. Harada, welcome, and thank you for joining me.
Thank you so much for having me.
You spent portions of your career working in both the public and the private sector. And from your experience, what makes leadership in the federal sector different than the private sector?
At the highest level, leadership in the public sector is very fundamentally at its core mission-driven. Right? The work is in the service of the public good, and the goals and the programs are frequently long-term, they're systemic, and they're incredibly complex. And success, isn't necessarily measured by quarterly earnings. We don't have that kind of drumbeat, but certainly more by the lasting impact that we have on Americans' lives. What's also unique about public sector is, in my view, the profound sense of history that you feel. And I think certainly I was very aware about the work that I was doing and how it builds on the efforts of those who came before me, and that future generations of leaders also depend on the decisions that were being made today. And that, for me, certainly provided a greater weight of responsibility.
That's a wonderful answer. And I was in the private sector for much of my career, and now WEPA is a nonprofit, and I really relate to what you said about being mission-driven rather than profit-driven. You've got a long-term view, and always at the core of it is serving others.
Yes.
Is there a moment that stands out to you from early in your career that influenced your leadership style later on?
I started out my career as an aerospace engineer, building satellites and airplanes. And when I first entered the workforce, my organization at the time had 120 people. We were a large company, 120 people, 4 women, and I was the only woman of color. I was also the youngest throughout the entire organization. And so, I remember having an experience when I was doing some engineering work. We had a design review, and I had seen some issues with the flight software that I pointed out. At the time, they're like, maybe it's not really that big of a concern. I was like, but in my heart, I knew that the issue was real and stayed with it. And sure enough, a few weeks later, that topic came up again, and we addressed it. Turns out my concern did indeed prove to be valid. And so it's just one of those experiences that really sank into me around ensuring that I am listening to everybody, period, end of story, within the organization. Really thinking through about how do we take into consideration opinions from all different spectra, as a third generation Japanese American, right, I was raised to be humble, keep your head down and work hard, etc. But at times, leadership also requires you to speak up, do so politely, with courage, etc. Even though you may be the only voice in your room, but certainly trust your voice. It also really helped shape my belief around diversity. DEI programs right now are viewed in a negative light. We're all mosaics, and they become better because you have those different experiences, and that's really stayed with me throughout the entirety of my career.
The diversity issue is a really big one coming from the insurance industry. That's an industry which is working on that. It's really a diversity of viewpoint and perspective and experiences that does influence your business, and more diverse employee bases absolutely helps. Was there a time in your federal career, perhaps when you were at OMB, that you faced what you consider a real challenge, and how did you overcome it?
One moment that really stands out in particular was when I was serving as the Federal Chief Sustainability Officer during the Obama administration. We had set, like many administrations, had set some really ambitious goals, very, very, very ambitious goals around how do we think about making the federal government's operations much more sustainable. But the challenge wasn't so much about the scale or the technical capacity of the organization. A lot of it was really centered around the funding. We overcame this largely by being very strategic, helping out with blocking and tackling with the variety of legal issues or legal questions that might have come up, like how do we address this? Certainly in the federal government, you're more often leading through influence as opposed to pure form authority, and that you really need to listen deeply, communicate clearly with folks, building out those coalitions and engaging with your stakeholders. And I know many folks in government speak like that, but that is the truth.
As someone who's spent time in both the federal and the private sectors, what makes the relationship between the two sectors important?
Certainly, it's an absolutely essential partnership, and I would add on to that like nonprofits or philanthropic organizations. As I mentioned before, I'm Japanese American, and in Japan there's a symbol for thunder, which looks like 3 arrows pointing around each other in a circular pattern, kind of to represent the swirl, if you will, of clouds. And that's kind of how I view the relationship between the government, the private sector, and the nonprofit sector. The government frequently sets the vision, the policy, the direction, but of course it's the private sector that brings the capital, the innovation, the skill set, the capabilities, et cetera, to be able to execute. Partnering with that, of course, are the nonprofits who may be supporting the surrounding society. Public-private collaboration is not just about contracts or compliance, but it's also about figuring out what's your shared purpose. That's when real transformation can and does actually happen.
In life insurance, there's a concept, lifetime value, where bringing a new insured in costs a lot more money than the amount of premium. And so when you talk to commercial carriers, it's a similar kind of thing. You need to bring them into the concept that they're going to be with us 20 years, and after 5 years, you can ride through that. But it's a concept that isn't easy for commercial businesses to understand. That's a partnership too. Very, very similar. What advice would you give to somebody aspiring to become a leader in government?
There are 3 things, right? So firstly, around leadership in government, you want to make sure that you're leading with purpose. You want to stay grounded in your values, and don't underestimate the power of relationships. Remember why you entered public service in the first place, and that'll help carry you through some of the inevitable challenges that you're going to face. Making sure that you are also investing in relationships. In government, you rarely have full control, and I think this is, in my view, more important in government than perhaps in the private sector. You are frequently leading through influence. You are collaborating with very different parties who frequently have very different agendas than you do. And so building that trust, investing in building that trust and planting those seeds earlier and along the way in your career, I think is absolutely critical. And certainly last but not least, I would say, don't feel that you have to have it all figured out on day one. Absolutely stay open to the unexpected. Say yes to the opportunities that stretch you, and know that you can lead from wherever you are. It's not just about position or hierarchy. It's about the impact that you can have.
What wonderful advice, especially in today's world, which is a little topsy-turvy. Who is one person, someone you know personally or perhaps someone well-known, that's impacted your leadership style?
The leaders that particularly stand out for me are Colin Powell, a woman named Carla Harris, who was a managing director in investment banking, and then last but not least would be my father. Starting with perhaps the more famous one, Colin Powell. I read his biography, loved his perspectives and the rules of leadership that have been particularly influential for me, right? So get mad, then get over it, share the credit, perpetual optimism, a force multiplier, things of that nature. And hearing his story was certainly very inspirational for me. And so I certainly very much look up to him as a role model. The second person that I mentioned is a woman named Carla Harris. She's an African-American woman, became a managing director at an investment bank in the 80s, at a time when there were not that many women of color in investment banking in New York. And so she's published a book called Her Pearls of Wisdom. It's one of her trademarks. She always wore a pearl necklace, and she has pearls of wisdom around how can you be authentic and build relationships to be successful in super challenging environments. And she had a lot of guidance on the importance of finding sponsors and mentors. And certainly last but not least, my father is really my why for I do a lot of the work that I do in the public sector. He started out life like many other, immigrant kids in poverty. He was a strawberry farm laborer. Japanese Americans at the time were not allowed to own the land, so we worked the land. He grew up in that kind of environment. And I just think it's absolutely neat that someone who came really he was dirt poor, to say it, and his daughter ended up working in the White House twice. It's quite the American dream, and I would very much like to have that opportunity available for other people as well.
Well, wonderful, absolutely wonderful. Christine, thank you very much for your time today and all of these learnings. It's really good, impactful. Thank you for sharing.
Oh, thank you so much for having me. I really enjoyed it.
I'm Shane Canfield, CEO of WEPA. Until next time on Lessons in Leadership.
Find the full podcast and future episodes of Lessons in Leadership on the Federal News Network app and anywhere you enjoy your podcasts.